Welcome back to I Am Refocused Radio. Once again, we are here today with a special guest, Dr. Hélène Bertrand. She is a physician, researcher, and internationally respected leader in the field of pain management. She has some amazing stories she is going to share with us that's really going to help a lot of lives. With decades of clinical experience in family medicine, Dr. Bertrand has dedicated her career to uncovering effective, non-invasive solutions for chronic pain, empowering patients to reclaim their health without the risk of over-medicine or dependency. Her pioneering research has also explored the interactions of neuroscience, physiology, and holistic healing, offering innovative strategies that also address pain at its root rather than masking symptoms. First and foremost, I know you took some time to be with us today, Dr. Bertrand. How are you doing, first of all?
I'm doing fantastic. I'm having a wonderful time. I just came back from a 10,000 step walk up and down steep hills, and I fixed somebody's knees. It's wonderful. It's just so much fun.
That's great, because I know there's a lot of people that can use your not just wisdom, but years of experience in the health industry. So let's get back to your personal journey when it comes to what inspired you to focus your final chapter in your medical career on patients with chronic pain. Where do you see the common thread of people who don't know what to do with their pain when they come to see you?
Well, I have to tell you that I've learned how to deal with pain because I had 39 years of really awful low back pain. And so that makes me feel very sorry for anybody who's got pain. Believe me, I know what it's like. And that's why I decided to focus most of what I did on relieving chronic, severe pain. In fact, in the last 12 years of my 55-year medical practice, all I did was take away pain. And doctors would send me their hopeless cases, and 80% of them left my practice with little or no pain at all. Because when I see somebody who's got pain, the first thing I want to know is what's causing it. A lot of treatments nowadays just cover it up. They cover it up with medications. They cover it up with injections. They cover it up with surgery. But they don't actually treat the cause. And if you're not treating what's causing the problem, then the problem remains. And that's what I've done in at least the last 12 years of my practice, was just finding the cause and treating that. And that's why most of the people who I saw who had low back pain ended up with no pain, because I removed the cause. So that's, and I learned a whole bunch of things doing that. The first thing I did when I had this terrible low back pain is I thought, it's not coming from my spine. I knew that because the pain wasn't where my spine is. And I examined myself, and I then found out that my pain was coming from the joints between my pelvic bones. You know, the bones of your pelvis are huge. If you put your hands down here below your waist, you'll feel the top of your pelvic bones. And you're sitting, your sits bones are part of your pelvic bones. So this is a big bone. And those bones, essentially, they carry the weight of your whole upper body. Your head, your neck, your shoulders, your liver, your kidneys. the fat, everything that's part of your upper body is pushing these pelvic bones away from the sacrum where they attach. The sacrum is that little triangular bone at the base of your spine, and that's where your pelvic bones attach. And these bones are invisible to X-rays, CT scans, MRIs, ultrasounds. You can't see them because they're totally different from all the other joints. Did you know that?
I do know.
Essentially, and you know why they're different? Well, there's another joint inside your pelvic bones. It's called your hip joints. Every time your foot hits the ground, your hip joint is jolted. And so that joint is your body's shock absorber. And so in order to absorb the shock of every step you take, instead of being smooth like every other joint, it's full of bumps and hollows to absorb the shock. And because of that, it's invisible to X-rays, CT scans. They can't see what level they have because they can't see the limits of that joint. There's too many bumps and hollows. So that is when I decided to feel my pelvic bones. And if you put your hands behind your back and you feel, you'll feel these two little bumps. Try it. People should try it. Just try feeling, it's below your waist, inside your buttocks, you'll feel the two little bumps of bone. And if you feel those two little bumps, then you know if your joints are okay or not okay. Because if you've got pain underneath those two little bumps, that means that joint is out of position. And if you have pain and it hurts, and that the one that's hurting is higher than the other one, then you know it's too far forward. If it's lower than the other one, it's too far backwards. And if it's too far forward, you're going to push it back with your thigh. And if it's too far backward, you're going to stretch your thigh as far back as you can until you feel a pull. And then you hold that position. You can do it with a lunge, for instance. Hold that lunge for 2 minutes, and 90% of those who have pain there are going to feel immediate relief. Now, they kicked me out of the Canadian Pain Society because of that.
When you think about innovations that you also have developed along the way as well, the natural cream, can you also kind of tell us what's the process of building that and how has that been helping people as well?
Well, I went to a conference where this guy was injecting a sugar solution around nerves, and instantly the pain would disappear. Nerves that went to painful areas, if you inject that solution, poof, it disappeared. So I started doing that, but then I had a lot of diabetic patients. And those diabetic patients, I didn't want to put sugar around their nerves because sugar is destroying their nerves. So I thought, what else could I put on? And I thought, well, there's this substance called mannitol. Mannitol is a sugar molecule with one OH, half of a water molecule attached to it. And I thought, well, that's as close as I can get to a sugar molecule without damaging nerves. And so I started injecting mannitol around nerves. And I got the same result. As even before the needle was out of the skin, poof, the pain was gone. And so I thought, wow, this is great. And then there were a lot of doctors and pharmacists who came to observe my practice because I had good results. And this pharmacist looked at me injecting this mannitol solution. And she says, I've never seen pain disappear so fast and so completely. But she said, people don't like needles. Why don't we make it into a cream? I said, sure, let's make it into a cream. We had to try 16 different base creams before we found one that allowed the mannitol to penetrate through the skin and to reach the nerves. When I found that one, I tried it on 235 of my pain patients, like everything from migraine headaches to pain in the neck to burning feet to pain in the knees to pain in the fingers, all kinds of pain. And Marilyn was making the cream in her kitchen. And she's the pharmacist, and she was giving me these little containers of cream. So I would give my patients those little containers, and I would say, well, you need to fill out this questionnaire. Otherwise, you're not going to get any more. So they filled out the questionnaire, and the questionnaire said the date, the time, how bad is your pain from 0 to 10 before you put on the cream? How bad is it 30 minutes later? How long does it take to relieve your pain? And how long does it last? So I've got this database for 289 different conditions. And it turns out that the average pain relief was 53%. Okay, it's not 100%. But the average pain relief for narcotics is 36%. The average pain relief for anti-inflammatory medications like Advil or Voltaren is 23%. The average pain relief for Tylenol is 13%. So 53% is pretty good. And then I did I wanted to know how come there was relief from this cream. And so I decided I would test it on my patients. My patients wanted more of this cream, obviously. And so what I did was I had them chomp on a paper towel. And then I had them, I put a little tape in the middle of their lip. And then on either side of their upper lip, I put some capsaicin cream. Do you know what capsaicin is?
Sounds like uncle, right?
Hot pepper cream. So when the burning reached 8 out of 10, it was burning, I removed the capsaicin cream, and on one side I put the base cream, and on the other side the base cream with the mannitol. I didn't know what I was putting on. I was given a pink Q-tip for the right, a blue one for the left. That was it. And so every minute they had to tell me how bad their pain was on each side. And on the mannitol side, the pain went like that. And on the base cream side, it went like that. By 3 minutes, the probability that the two creams were the same was less than 2%. And by 10 minutes, it was less than 1 in 1,000. Everybody knew which side had the mannitol, because on that side, the burning had disappeared, whereas it was still persisting on the other side. So that's how I invented this mannitol cream, and I tested it. So now I know that is more effective than almost all the other painkillers. So I'm very glad I made it. By the way, this is what the box looks like. It's called QR cream, and I called it QR because it's quick relief and it's cure. Because I tested it one medical student came and tested it on people who had pain after shingles with an average duration of 5 years. And these are people who can't even wear a shirt because it rubs on their shingles, or who can't sleep because every time they move in bed, the rubbing of the sheets is waking them up. And they essentially, but they had to use the cream for quite a while. And the relief was every time they put on the cream, there was a little more relief until eventually their pain disappeared. But it took 3 months for the pain to disappear. But considering they'd had shingles for 5 years, that's not bad. And I've done I had a lot of fun with that cream. I had this woman with I used to do a lot of treatment for joints, like injecting sugar water where the ligaments and tendons attach on the covering of the bone, because that is the only place you can inject that will allow repair of ligaments and tendons. So one doctor sent me this woman who had terrible, terrible pain in her shoulder. And when she came in, she was like this. And I said, well, if you want to stop the pain in your shoulder, you've got to stop scratching, because every time you do this, you're hurting your shoulder. She said, I can't stop, doctor. I've had 15 years of itch from my psoriasis. By the way, she didn't have any hair on her head. She just had psoriasis. And she said, I've tried everything and nothing works. And I said, well, would you like to try my cream? I was testing it. And she said, it won't work. And I said, well, you don't know. You haven't tried it. And she said, nothing works. And I said, well, try the cream. So she put on the cream, and 3 minutes later, her itch had disappeared. And when she came back, she had this much hair all over her head and no psoriasis. And for me, that's the sort of thing that gives me a lot of pleasure. Like you really can change people's lives when you do things like that. So
once again, watch the Non-Refocused Radio online and listen to us as well. Talking to our guest today, Hélène Bertrand. Want to say this is really good information that you're giving to our audience, and I always want to make a disclaimer because you got to in the podcast world radio. Make sure you check with your doctors first, and make sure you do your homework. But I want to get into the event you have later coming on in this month of September. You had something, you held a sheet of paper in the green screen. So kind of tell us a little bit more details about what you got planned on later this month.
Well, Shemaiah, I want to tell the whole world how they can relieve their own pain. And I'm going to give a free webinar on September 24th. And you can find out about the webinar if you go here. If you go here, all you have to do is essentially go to no-pain.ca. And there you'll see the ad for the webinar, or you can go to no-pain.ca and webinar. And if you want, after that, I'm going to be giving a course. But unfortunately, people will have to pay for that because I'm going to spend a lot of time with those people. And I have to be paid for all the time I spend with those people. And but if you go to no-pain.ca/course, you can go to the course. Now, if you want to advertise the course and somebody you advertise to takes the course, then you get it for free. You become an affiliate. So you could do it that way too, have somebody else pay for it. And the other thing I'd like you to see is this qrcream.com. because that is how you get all the information on how to use QR cream to make yourself better. And you can, and on the front page of the qrcream.com, you've got a picture of a man, and he's got little numbers wherever you would be hurting. If you click on the number of the area that you're hurting, you'll immediately be taken to where you hurt. And they then an explanation, like I did research on the cream, and so I can tell you how many people I tested who had that particular problem, and what we did and what can be done on top of the cream to provide you with pain relief. So it's pretty useful. And you can get the cream, by the way, on Amazon if you're looking for it. It's easy to find. All you have to do is put in my name, Hélène Bertrand, and you'll find you'll find the book. You need to put QR cream for the pain relief. The book is called Low Back Pain, and it's for people who have low back pain, because most low back pain can be relieved very easily. And in the book, there's a bunch of QR codes that tell you exactly what you need to do. So, and that's on Amazon too.
The last question for you is, when you look back at your career, what is the most rewarding part, just reflecting of all the people you help even now? Because there are a lot of times where people, they want to go to the doctor, but they want another opinion. But for you, you care deeply about the well-being of your patients.
Oh, yes.
Most rewarding part for you.
Well, that was like, sometimes when I was fixing people's low back pain, they would say, "It's a miracle." Hey, that was a great feeling, let me tell you. It feels wonderful to be able to take, or sometimes I would inject this mannitol around nerves, and poof, no more pain. And these are people who've been suffering for a long, long time. And for me, it gave me, because I knew what it's like. Hey, I had 39 years of low back pain. I know what it's like to suffer, and I don't want anybody else to suffer like that. And for me to know that they're getting better is like the best thing that I can experience. I used to look forward to going to work every day just because I knew that there were a lot of people that I could help. And that's really been the most rewarding part of my whole life, is to know that I've made a difference for a whole lot of people. And like, I'm very old, and that's why I'm going to be giving that webinar. I want to make a difference for even more people. And the course, of course, then I'll meet those people, and I'll know what's bothering them, and I'll be able to make suggestions or to see what's happening, and then to tell them what they can do to remove their pain. And for me, that's like super important.
Well, I appreciate you sharing this good information with our audience. Like I always want to say to our guest, Dr. Hélène Bertrand, appreciate your time on the show and what you're doing for the community.
Well, thank you so much for having me, Shemaiah. I very much enjoyed our interview.